Good evening and welcome to Georgia Medical Academy's online EMT to Advanced EMT program. My name's Tom Camplain and I'm your instructor for this course, and I'm glad to have you here. And today we're going to go ahead and get started, and we're going to start on of course, Chapter 1, our introduction. So, with that said, what are we going to do here in this class? Well, first of all, we're going to bridge the skills that we have as an EMT over to that of an advanced EMT. So to do that, these are the steps we're going to take. And this is our new thing that you may have heard. It's been out for a few years now. It's called the National EMS Education Standard Competencies, which has changed from the old way it used to be, all about time, sitting in the classroom for X amount of time. Now it's about competency. So we have to make sure that you are a competent professional EMT in the field. So what we're going to do in this class is you're going to learn how to apply the fundamental knowledge of EMS, safety, well-being of the advanced EMT. You're going to learn about medical, legal, and ethical issues to the provisions of emergency care. And all this is going to be listed in this chapter. We're going to go over EMS systems. We're going to talk some about the history of EMS. We're going to go over the roles and responsibilities, professionalism of EMS personnel. We're going to talk about quality improvement, patient safety. And then we're also going to get into a new subject that is kind of scary to a lot of people, and that's research. And we're going to take the scariness out of research, and we're going to really dive into it a little bit and show you how it benefits you and the patient and the public, and how it is going to open up doors and opportunities for all of us in the future. And a new thing that it's really always been there, but now we're putting a little emphasis on it, and it's public health. How we integrate with the state and local public health agencies, especially in the event of a public health emergency. So that's what we're going to do in this chapter. The chapter will be broken down in small chunks like this. If you can see, I'm kind of using YouTube because YouTube and Screencast, but both of them are very reliable systems, so I really don't have to worry about them going down much. And I know that there's professionals always on the back end keeping those sites up and keeping them safe for us. So with that said, let's look into the introduction. All of you should have your book now. If you're in the course, you've got your book. If you're not in the course, you're kind of waiting on your book to get there, and you're accessing this through YouTube to kind of get a head start. But when your book comes, you will get the AAOS book, which is one of the first EMT books ever published. So the author, she is here locally down from Macon, Georgia. She's a very good author, and the book is a very good book, and I think you'll enjoy it. So use it as a resource, okay? So that's going to be the main book that we use. All right, so we've kind of talked about the chapters, what we're going to discuss. We're going to discuss about EMS, and EMS is an entire system. You're not just EMS. There's a lot more to EMS than we think of. EMS composes of the citizens who call 911 all the way to the physicians and nurses that are taking care of these patients in the hospital. And we're going to talk about how they influence you as an AEMT, and even up through any of us. It applies to our EMTs and the paramedics as well. So we're going to we'll dive into the administrative aspects, talk about who controls EMS, especially here. You know, on the state level, EMS is a state component. However, we do get funding from the federal government as well. So, and then we're going to talk about the roles and responsibilities that you are expected to live up to. So, EMS, what is it? It's a team of healthcare professionals. Like I said earlier, you're not in this alone. It takes someone to call 911. It takes someone to sit at that patient's side before you get there, usually first responders, firemen, or police officers, or lifeguards, or just a nurse who's off duty, or maybe a physician that's there to help begin care. Then you get there, you provide pre-hospital care and transportation, and while en route, you're providing high quality care to these patients. You are not, like I said, you're not in this whole entity alone. You're part of a piece of a puzzle. You're part of a local or a regional EMS system. Most of the times, you feel like you're more of a local entity, but really whenever something big happens, think about it like Hurricane Katrina or the terror attacks, you become much larger. You become part of a regional system very quickly. Now, EMS itself is governed by state laws. And typically we are regulated by EMS offices that are located within regions, and the regions have regional control, and anytime you need anything you will go through the regional office, and then if the regional office cannot help you, they will refer you to the state office, and from the state office, that's about it. Their decisions are final. The states are the ones who license you and authorize you to function as an EMT or an advanced EMT in the state in which you reside. So down here at the bottom it says people who provide emergency care except licensed physicians must be state licensed or certified. Now I'm going to take that term except licensed physicians. I don't understand why that's in there. However, in most states I know physicians have to be licensed. Here in Georgia they have to be licensed except for, and I can see where they're coming up with this, when they're doing their internship or they're in their residency. They're not technically licensed 100%, and then but they are still authorized to provide care. But you as an EMT, before you can get out and provide care on your own, you have to be licensed. So we have 4 training levels. We have the EMR, that used to be the first responder. Now we call them EMR, emergency medical responders. EMT now, which used to be called the EMT basic, and I will call them EMT basics, and you'll have to correct me every time. Then you also now have the AEMT, which you are taking right now, used to be the EMT intermediate. And now the next level and the highest level is the paramedic, which used to be the EMT paramedic, and all they did was take the EMT off. So EMRs, what are they? They're the first responders that we're accustomed to. They have basic training. They provide basic minimum care in between the time that they get on scene versus when we get on scene as EMTs. And they may assist the EMTs and paramedics with care on the way to the hospital. Now, EMTs have additional training, and all of you that are in this class are EMTs, so you know about that. You know what you can do. You're trained in AEDs and airway adjuncts and assistance with certain medications. Now, the AEMT, which you're sitting for right now, they have a little more advanced training. So on top of the basic EMT basic training that you have, you're going to learn about intravenous therapy and administration of certain medications that we'll get into. And you'll also learn a few more advanced airway techniques in controlling and managing the airway as well, especially on transports. Now the paramedic is a little more advanced. Actually, they're a lot more advanced. The step from AEMT to paramedic is pretty big. They're trained in IV therapy and even more advanced IV therapy. They're trained in giving IV drip medications as well as the standard IV medications. They're trained in a whole slew of pharmacology. They're trained in cardiac monitoring and other advanced skills, which we can list. We can list a whole lot of those as well. So the AEMT role, which was used to be the EMTI. The EMTI used to be governed by 2 curriculums. It was the E85 and the E99, or the I-85 and the I-99, and they were 2 totally different levels. And what's happened now, we have come up with the advanced EMT to kind of standardize this across the nation. For instance, here in the state of Georgia, EMTIs are not allowed to intubate or perform cardiac monitoring. However, in Alabama, intermediate 99s could intubate and use a cardiac monitor. So when you finish this course, you'll be able to take your state certifying exam, which, depending, because I know some of you are from other states, you'll be taking the National Registry exam, and then you'll be applying for reciprocity into your state with your National Registry. Those of you here in the state of Georgia, you will be taking the National Registry exam as well. So thank you, and that concludes this first lecture.